Well, hey, folks, welcome to episode 3. This episode focuses on a few respiratory conditions. We'll start with asthma, we'll look at emphysema, and then I want to take a look at tuberculosis. Now, asthma is an important one to me. One of my children suffers from it, and it's an immunoreaction to something that is bothering your lungs. And what happens is exactly what you see here, a constriction of the airways to the point where not enough air is being exchanged, and it makes you feel faint and weak. And, well, let's take a look at what it really is. Now, if you look at your bronchioles or bronchi in cross section, you should see a nice wide opening. But due to something that's irritating you, whatever that is, smoke, dust, an old pillow, cat hair, that lining will constrict. And then when the bronchiole constricts, there's much less airflow. And you can also have a problem with mucus as well. If you get an asthmatic attack while you have a cold and you have a high mucus buildup, you have even less airway passage than you would normally have. So what really causes it? Lots of things. You can have cold air has been known to bring it on in some case. Allergies to a whole host of things, from those dust mites and pillows um, to dust on windowsills, being allergic to cats and dogs. Certain chemicals can bring it on if you're allergic to aspirin. You can have an onset of asthma from basically a chemical reaction in your body. Your body's reacting at something it doesn't like. So, smoking, not the best. I'm glad we're definitely decreasing it. Now, if you have an asthmatic episode, and I've actually had one of these, being I went out running one time and we had a lot of smoke from a forest fire. This is what I experienced, where I literally felt lightheaded and you're just pumping and venting and trying to get as much air into yourself as possible. My lungs had an inflammatory response or an asthmatic response to the fine particulates that were in the air. I went for a run at night and I didn't realize just how smoky it was, and had to double over at the waist and just pump and vent to try to stay just conscious. So you'll get lightheaded, feel like you can pass out, but you have to do everything you can to try to stay conscious. Bending over at the waist. If you have asthma, please make sure you have a rescue inhaler, right? Or if you have, some people have exercise-induced asthma, take your inhaler before you go out. So the way asthma is treated is to remove things that are causing the outbreak to begin with. Change those pillows, get rid of those little dust mites. You're actually breathing in their tiny little feces is what can irritate the lungs. There's animals, there's plants, there's smoking, there's certain products that your body just reacts to, amongst the others, wheat and dairy. It could be the first time you've tried aspirin, which you shouldn't try, by the way, until you're out of your teenage years. If these things cause an immune response, your lungs can react to it. The good news is, there's things that you can use to more or less protect yourself. You can have your emergency puffer, your sort of long range kind of maintenance puffer, and you'll do the testing where you'll blow into a tube and they'll determine how well you're venting depending on the medications that you're taking. So it's sort of a maintenance issue once asthma onsets. So good news is it's highly treatable.